The Islamic Academy of Education was established in 1991 by Mr. Yenapoya Abdullah Gunhi, an entrepreneur philanthropist, with a vision to provide quality higher education. As a non-profit trust, the Academy established Yenapoya Dental College in 1992 and set up medical, nursing and physiotherapy colleges subsequently. Over the years, institutions developed by this trust have created a niche in healthcare education not only in hinterland of Mangalore but also across the globe. In recognition for this contribution to the education system, in the year 2008, the Ministry of Human Resource Development, on the recommendation of the University Grants Commission, conferred the deemed to be university status. Yenapoya University thus became the first unaided deemed university to be established in the Dakshina Kannada district of Karnataka. The university, following the accreditation in 2015 by the National Accreditation and Assessment Council with an A grade, has diversified its academic prowess and scope by establishing Yenapoya Pharmacy College and Research Center and Yenapoya Institute of Arts, Science, Commerce and Management in the year 2017, the Yenapoya Ayurveda Medical College and Hospital and the Yenapoya Homeopathy Medical College and Hospital in the year 2018, the Yenapoya Institute of Allied Health Sciences and the Yenapoya College of Naturopathy and Yogic Sciences in the year 2021. Yenapoya University has secured accolades by various national and international certification and accreditation.
grants available from state government bodies, and many people are unaware of it. Non government sources definitely could be trust, like Lady Tata Trust, or maybe Indigo Remedies Trust, there's Fair and Lovely Trust. There are many such trusts. It could be from industrial houses, wherein you are identifying an industrial collaborator or industry is identifying you to carry on academic research. Also, it could be with some NGOs, public bodies, and even with venture capitalists if you're looking at some kind of translational research. For example, if you're working on anti-AIDS or anti-cancer research, collaborated with NGOs so that they could do those trials in a proper way, give us a feedback before we could do it in nicely, give it to industry and do the clinical trials. So, with funding from venture capitalists. International bodies also, there are many grants within universities, and now in India also it has started that universities themselves will support their faculty with a seed grant, so that that helps to generate proof of concept, and then you can approach government for a bigger grant. And it could be otherwise, like in case of national bodies, could be from government, could be non-government and private too. These are some of the national funding agencies. I'm sure you all are aware of Department of Science and Technology and Department of Biotechnology. But can we not apply to DRDO? We can. If you're writing projects which would be useful for defense organizations, you can submit a proposal to DRDO. If you are doing work on any waste material which can be converted into wealth coming from agricultural waste, it could be to Indian Council of Agricultural Research. Likewise, if you are utilizing any of the radioactive substances and either doing radiation polymerization or radio labeling, radio immunoassays, anything where radiation is a component, you can write to Atomic Energy Regulatory Board. So there are n number of grants which are available, and now in fact this list can definitely expand because people as well as the government wants to do multidisciplinary research. So where people from social science background are coming forward, making a format, addressing what customer needs are. Then we are taking surveys to understand what clinical needs are. We are collaborating within ourselves to make a formulation for which analysis has to be set up. So analytical people come into picture. Formulation needs to be tested. So pharmacologists come into picture. And then moving forward, clinical studies are there. So doctors are also coming into picture. If these type of things are including any kind of artificial intelligence as a component, suppose you're making a diagnostic technique based on mobile app, say for Alzheimer's, then engineers are coming into picture. So this is now going to expand like anything, and there won't be that if it is pharma, you need to apply only to DST or DBT. This is going to increase manifold. So these are some of the grants, and then websites are also mentioned. I'll pass on the presentation to organizers so that if any participant needs, it will be available to them. Now we should also look at grants, which are coming from some private foundations like Sri Padmavati Venkateshwara Foundation. Fourth generation is now working and giving money for biotechnology related research. And that money is not few lakhs. It goes to half a crore at times, depending on what your proposals are. So not only government agencies, but also your other agencies, private agencies are funding you. We should not restrict ourselves to only Indian government grants. In fact, there are many grants which can be written in a collaborative manner, like UKIERI, it is UK India Education and Research Initiative. So you can write to UKRI for a grant. In fact, three of us from ICT and four from UK, we collaborated on a project wherein 3 months their student came to us, and for 3 months our student went there. So whatever I made here using PAT tools, it was scaled up there, and their students gain information on supercritical technique which they did not have access to. Same way, when we went to UK, they arranged conferences and seminars, and when they were here, we arranged conferences and seminars. So such grants do exist and they work very effectively. Same is the case of US India initiative, which is India US Science and Technology Forum. You can identify one collaborator from US side, one could be from India side. And then there could be multiple such collaborators either doing conferences together or working for a specific project. BRICS, for example, is between Brazil, Russia, India, China, and South Africa. So many countries are coming together and funds are in billions of dollars, let me tell you. Cefipra calls are now open. Cefipra is from France. So Indo-French collaborative mode is Cefipra. Then there are grants from Japan like Matsume, German Research Foundation, from Germany, global alliances. I mean, these are just to name a few. Idea is that you identify, now you know that boundaries do not exist. All the research papers, review papers are easily available. So if you are actually having, Science Direct, Scopus as search engines, world has become very small. So identifying collaborator is no big deal. Sometimes we as Indians hesitate to write, but please remove that hesitancy. Write to them and you see that there could be very potential collaborators. So these are the funding agencies on the left hand side, on right hand side, websites are given. So you do have American Cancer Society, you do have Bill and Melinda Gates Foundation also giving you money. In fact, if your first proof of concept is generated, the grant can go up to $100 million. And we've been really lucky to complete the first part with $1 million. Next is awaited. So these are few more again from international point of view, collaborating with USA. Those who are working on specifically autism, like I know Punjab University working on it, they can get grants like SFARI. So same way, if you put the disease area in which you want to work and put, now for example, I put psoriasis plus international grant, there'll be a list of grants which will flash on Google. As I said, these are only few representative grants from all over the world. Lot of people, no, thousands of people would go on DAD, this grant to Germany. Same way, you do have Humboldt Fellowship for people who want to go to Germany. Very recently, Hamid Visiting Fellowship was instituted, and this is by name of CIPLA's founder, YK Hamid. So one could go to Stanford and do research. This is just yesterday's edition, wherein what exists immediately is being indicated. So you do have India EU cooperation on research and innovation, wherein there are grants for pandemic preparedness and response, on brain disorders, on healthy and environment friendly food. So it could be the nutrition, could be nutraceuticals, and all of us are working in those areas, right? We are utilizing herbal actives to make dosage forms. We are making nutri cosmetics also nowadays. So anything given orally to improve skin elegance, or anything which is applied topically also to improve overall elegance. Biofuels, another area where n number of grants do exist now. So IEU, that's India EU Cooperation on Research and Innovation, has actually point wise listed what would they be funding. And if you go to the website, all these information is available. If you look at DST, that's Department of Science and Technology, Ministry of Science and Technology, Government of India, very recently there's a proposal which has come up for Indo-German Science and Technology Center, a joint initiative, by Germany and India. And within that, there are 2+2 projects. What are these 2+2 projects? There's a call which is from waste to wealth. So goes for sustainable packaging. Can you identify an ingredient from waste which can be used as a film former and can be packaging any kind of product, then be it soaps, be it fruits and vegetables, be it pharma products? You can either do two people from India side and two people, of course, from Germany side are needed here. Now, these two people can be from academia, or one can be academia and one industry. Same way, one academia, one industry on the German side, and look at the amount of grant which is given to this particular initiative. 350 lakhs given to Indian side, which is huge for 3 year period, and there are hardly any takers. Same way, US India Science and Technology Forum is now focusing on critical and emerging technology, quantum technology, and AI. We know that AI is going to transform all our lives, right? Daily you are hearing of new tools for AI. So why can't we start working in that area and take the lead? Same way, quantum technologies can be a very useful technology for diagnostics, for theranostics, and a lot of people are working on many kind of metallic ions, for quantum technology. But can we not take lead and give to world something which is cheap, something which comes from indigenous sources and yet acts as quantum dots? So a lot of research in ICT is going on both these technologies. These are some of the other active call for proposals. If you look at DST site, there is Nidhi, Weber Fellowship, DST NSF joint call for proposal, India Japanese Science and Technology Corporation. So, in fact, all in all, I can say that there are many grants available. It's only that we have to have specific ideas, which are workable ideas, can be delivered in time, and then you can move ahead and write projects. So, do we have everything for faculty? Answer is no. We have many things for our research students. Research students who are pursuing research. So, what is available? They can get fellowships. UGC, of course, is only for those who have 12B certificate. But those who are merit rankers, they can apply for Inspire Fellowship. So Indian government does recognize merit, right? So if you are first in your own university, you get red carpet. In fact, even in ICT, they don't have to qualify ICT entrance exam. They can directly join after a small interview. Those who clear JRF, DBT's exam, they also can enter in the same way. That means a small interview just to judge whether you have research potential and you can be in. There is Fulbright Nehru Fellowship and Welcome Grants. In fact, they are the grants on which student can go to USA and UK respectively. And everything starting from your visa fee to travel, to stay expenses, to insurance, everything will be covered by these fellowships. And not many people again are applying for it. What is required is you have to have a sponsorship letter for that same country. That means if you're applying for Fulbright from US, you should have that letter. It is letter just in support of your application, right? Other things are you're getting from the grant itself. Many people are also not aware about single girl child. UGC does give money for 30,000 rupees if you are a single girl child. You do not have any siblings and you are a girl. Plus, Prime Minister's Fellowship. This is a maximum paying fellowship. Currently in our lab, we have about three Prime Minister's Fellow. What is requirement? You have to identify an industry, have a project which is translational. Industry gives half the money, government puts in half the money. That means DST and CII both put half the money. Net result is student getting, while doing PhD, 93,000 per month, which is a huge fellowship. So, Prime Minister's Fellowship, either the mentor can get the industry partner or even student can identify the industry partner. What is the requirement? Only requirement is that within 18 months of your registration for PhD, you have to apply. I told you about government promoting Inspire Fellowship. This is a snapshot for that, wherein first rankers can apply for this particular grant. So directly from after B Farm, you can get integrated PhD, or if you are master's topper, you can get PhD. Besides that, for students, there are short-term exchange programs also, like CEFIPRA under Raman Charpak Fellowship. I think this is open right now. I'd seen a circular some days back. GRD Tata Trust. Many of our students go on this Newton Baba PhD placement in the UK. In fact, very recently, one of my students went on Commonwealth Split Site Scholarship to University of Belfast. So half the work, formulation work was done here. Microneedle loading was done in UK. Again, animal studies, part of it were done in India and part of it was done in UK. They were so happy with her performance that already she has gone for postdoctoral fellowship. PhD thesis is just submitted. Viva not done, but got the opportunity to do PDF there itself. So likewise, you do have other programs with Sweden, with Korea, with New Zealand, with France, as I mentioned earlier. Everything is online. So all you have to do is explore, have very strong recommendation letters from your mentors, and apply. Same way, there are travel grants which are available from students for students from DST, from DBT, CSIR, ICMR. Many people do not know that Center for International Cooperation in Science also gives such grants, and also Ratan Tata Trust. In fact, many times if you are requiring travel and other things, interest free fellowships are also given by Tata Trust. Only requirement for all these travel grants is that you can avail it once in 3 years. So students are smart. They want to go abroad every year to network, right? To establish contacts. So 1 year they'll apply for DST, another year it will be ICMR, and third year it will be Ratan Tata. Fourth year they'll take it from industry and see to it that in fact, we are happy sending them because that kind of exposure, that kind of networking is necessary for them to understand what goes in the world. This is a snapshot for DBT, and CTEP stands for conferences, travel, exhibition, and popular lectures. So you can get money for any of these. Eligibility to apply is that you should be a faculty or you should at least be doing your PhD, and you can apply once in 3 years. All these are open throughout the year. But again, the condition is when you're going, see that if you're applied for a conference abroad, ask acceptance of abstract early, because you need to apply at least 2 months in advance. In fact, nowadays, many authorities say 3 months in advance for all these grants. After PhD, again, there are a number of the grants. And in fact, these both students as well as faculty can look for. This is a saying by Albert Einstein that intellectual growth should commence at birth and cease only at death. That means you have opportunities throughout your life. It depends on you how to take advantage. Postdoctoral fellowship, you'll be surprised that you have DS Kothari postdoctoral fellowship. Again, there are not many takers, and these people get about 65,000 rupees plus HRA, plus they get contingency for the research work they want to do. So it's as good as taking up a faculty position. Same way you have from SERB, National Postdoctoral Fellowship, from BIRAC Innovation Fellowship, from MHRD, USA Postdoctoral Fellowship. All of these pay amounts almost equivalent to entry level faculty members as per, I would say, seventh pay scale is concerned. In addition, teachers who are really meritorious can get these fellowships. So there's Swarna Jayanti Fellowship, J.C. Bose National Fellowship, Ramanna Fellowship, Base Fellowship, and recently what I got was APJ Abdul Kalam Fellowship. What do you get by getting these fellowships? You're getting 15 lakh per annum to do your own research. You are getting over and above your salary about 25 to 50,000 rupees. Plus, you are getting contingency, travel, everything. Almost all these grants are really, I would say, uh, government's way of promoting, good researchers. DBT similarly has Indo-US Career Transition Award. Here, the requirement is that the researcher will go to National Institute of Health in US, take experience, and come back. So it's a career transition award. But an NIH stamp definitely will work in your favor when you're back here in India. Many people from ICERS and some national institutes have got what is known as Welcome Trust DBT India Early Career Fellowship. Again, the perks are many here. So you are getting 20, 15 lakh, 15 to 20 lakhs, of rupees per year for doing your research. And what more do you want? Besides that, there are many other things, but I think one thing for researcher is to have a constant inflow of money so that they can better their own research. And for us, people like us, can we develop translational, technology so that they can roll out in the market and end users can use it. So again, this is a snapshot for Welcome Trust. You can see that as you move from early career to senior level, the perks go on increasing. So here you have 10 lakh contingency, early career you have only 2 lakhs. For international research, money is not even restricted. Whatever you ask, you will get. But your proposal has to be strong. You can take up to 4 people, including postdocs. So their salaries will come through this Welcome Trust. So, and government definitely is working to give you everything. Now it is up to us to open our Pandora box, think outside of the box, and get these grants. For young investigators, such grants, which amount to about 15 to 20 lakhs, are available. So I know of ICT faculty getting DAE Research Award. This is an award. Okay. So it is not a grant where you'll have to give some portion to the institute. This is award. So wherever it is written award, full money will come in your kitty to do research. This is a snapshot for rapid grant for young investigators. Idea of putting this is that you can see that it is for supporting eminent scientists from medical, agricultural, animal biotech, environment, as well as from industry. So we in the pharmacy, think unidirectionally. All we see healthcare, healthcare. But besides human healthcare, veterinary healthcare is equally important, and there are not many takers there. So if you're working in area of veterinary, you are bound to get grant. Like we have now a DST grant, the SERB grant, wherein 2 academic institutes have collaborated with one industry Rather, three academic institutes, I would say, have collaborated with one industry. For women, again, there are many grants and government is promoting. They do understand that women can have break in career due to variety of reasons, which I need not tell here. But yes, there is WSA, which is for basic and applied sciences. If you're working in anything to address societal needs, you have WSB. And nowadays there is WSC also. If you want to work in area of IPR, there's WSC. And you can see the money which you can get. Even if you have break in the career, you can rejoin. But identify good mentors. Very important that you submit projects, and those projects should be, the government should feel that they are worthwhile to be supported. Same way, from DBT and UGC also, you do have funds. You can see here, you need to apply under life sciences code. Now, this is a mistake which pharma people do. They say pharmaceutical sciences is not written, so we are not eligible. Many people have come to, but we fit under life sciences. So obviously, if you are doing anything in the chemical science, you can apply for chemical sciences also, but most of us fit under life sciences. Now there are fellowships for faculty position also. So you can be Inspire Fellows. And these Inspire Fellows, again, besides getting their salary, will be getting enough money for research. So we have many DST Inspire Fellows in university. In fact, we take advantage of them rather than taking some contract researchers for teaching. You have DBT's Khurana and Ehrenberg Scholars Program. What I told you earlier, that's also a fellowship. And then from Wellcome Trust also fellowship is available. Just a snapshot for Inspire Faculty Scheme, I would say that if you are from central institutes, obviously your directors can nominate you. But if you are not, see that some vice chancellor or president of a society nominates you to be Inspire faculty. That way it goes faster. Nevertheless, government has opened the direct route also, wherein you will be shortlisted, then you will be asked for recommendations, and then you will be given the Inspire faculty position. Upper age limit is does exist here. It is 32 years, and they support for 5 years. So then your institute has to make sure, wherever you will be joining, has to make sure that they give you support after 5 years. So that undertaking has to be given. Other thing which now Inspire faculty government has done is, they say that if you get Inspire faculty position, do not go to the same institute. Rather, they say do not go to the same state also. That way, if you are, encouraging this cross breeding, I would say different ideas would come. And that is helpful for growth as far as research is concerned. This is about re-entry grants. So if you have any friends who have gone and settled in US, UK, Australia, anywhere, they can come back to India if they desire on Ramanujan Fellow, Ramalinga Swami Fellowship, Wellcome Trust. And again, these are very coveted fellowships. Two of my students have come on Ramanujan and Ramalinga Swami back because they wanted exposure to US, UK, Germany, right? After they have their kids, they don't want them to grow in that environment. So they are back. So for them, whether something will be available, yes, fellowships are available. And this is a snapshot for Ramanujan Fellowship. Very clearly, you can see here it's written, it is especially for those scientists who want to return to India from abroad. The very scientist specific, very, very selective procedure is there. In fact, a full continent, I would say that a panel goes, about 10 people go every year to interview them in their respective countries and bring them back. Then there are grants for travel, for many other things. You may say there are so many grants, how do I keep track of it? So you can just keep in mind indiabioscience.org. I repeat, indiabioscience.org. If this is open, continuously you'll see some grant coming to which you can apply. And this is a snapshot from indiabioscience.org. Infrastructure. For institute also there are grants like FIST. I'm sure you'll be aware of MHRD. Now there's this also, RUSA also, Rashtriya Uchatar Shiksha Abhiyan. And obviously, I mean, ICT is old, right? We started in 1933. So we are recipient for most of these grants. Exchange programs and faculty development grants. Like students, there are exchange programs available even for teachers. And this is again a snapshot. You can see Indians sitting here. So very, very good India UK staff exchange program. And I have seen people who really come back. They come back satisfied in all means. It's not that, they've gone there, they've done research and they are back. The networking which they establish, it goes lifelong. In fact, you will be called for many of the programs later in life also. Now, these are awards, okay, award grants. That means money going directly into kitty of teachers. So you do have INSA Teachers Award, you have CLP Award. Look at the amounts, they are in dollars, 15,000, $50,000. DA Research Award, which one of my student got, 17 lakhs. Same way, US India Educational Foundation, James McDonald Foundation, all of them do have awards. There's some awards for women also again here. Lady Tata Memorial Trust also gives 25,000 per month in addition to your salary. But people have not explored much. Organization can get grants for seminars. So there's a complete list. For infrastructure, I've already talked about. For establishing centers of excellence, DBT gives huge grants. So you can, in fact, now it has become very important with NEP that you have center of excellence established in your own institute. That gives credit. Besides this, incubation grants, incubation centers exist. And this is a list of grants for incubation centers like Bioincubator Support System, BISS, Contract Research and Services Scheme, you have BIPP for industry, you have Seed Grant, you have LEAP Grant. In fact, being on the other side, on most of these committees, we understand that industry needs academia to write projects. Let me tell you very clearly, many times the projects are rejected because they do not understand what is expected. DST has mission on nanoscience and technology. You have TDB, NST, EDB, and many more. And these are just the snapshots of some of the incubation centers, well known centers, some in IIT Mumbai. You do have in NCL one center, a DST center, Technopark also there. No, we have a venture center. You do have IKB. There also there's a very good center. So these are some of the links for consolidated databases, which definitely will be passed on to you. Coming to the second part, and a very important part, we know that there are many granting agencies, many forums where we can apply. Then where is it that we fail? Are we short of ideas? I cannot accept that. So probably little more emphasis has to be given on writing part. You need to Identify which area you want to work. Now, that area should be something different than the area in which all others are working. Identify the niche area. Now, for example, when people were working on diagnostics, we started working on theranostics. When people worked on, say, NIR sensor, we started working on quantum dots. So you have to be abreast of what is happening in world. In fact, people use social media to their disadvantage. You have to start to learn to use social media to your advantage. I went on Twitter only because on Twitter, anyone who publishes their work, they are posting there and it's free for 15 days. So you can read that full article there. So made it a habit that before sleeping, at least 3 to 4 such articles should be read. So that keeps you abreast of what is going on in the world. Then you see what facilities you have and start working in that area. Other thing which you have to keep in mind is what is your agenda? Whether you want to generate POC, that's proof of concept, or you want to do advanced research. If you're doing advanced research and in your project you have not written anything about POC, you have not given any graphs or flow charts, advanced project will not be granted. If it is POC, you have to justify what was your rationale, what was your hypothesis. Accordingly, depending on whether you are asking money for POC or advanced research, you have to have budget. So, for example, during COVID time, we wrote 2 projects. One was simple colorimetry for COVID detection, which was a need of the hour, right? So we said that we will write it for 3 months, and the money which we asked was only 7.5 lakh. Same time, we wrote a project for vaccine for 3 years because it required many studies to be done, and we asked for about 1 crore. So budget has to go with what you're going to do, what is the time duration. We were lucky that both projects came through. So next is expected tenure, which I just said. Link these 3 things together. Budget should depend on the duration of the project and whether the project is POC in advance or advanced. Identify need for collaboration. I have seen that government agencies promote collaboration. In fact, they promote collaboration from outside institute. So you can have, of course, PI and co-PI from one institute, and you can have other PI and co-PIs from other institutes. So collaborate. That's a way they look at it, because in case someone leaves in between, others should be able to carry forward the research. So how do we start? We have to start with the research hypothesis. And this hypothesis has to be very, very clear. That means, why are we doing what we are doing? So, for that, you should know what already has been done so that you can identify what needs to be done. And if you can give it just like you give graphical abstract in your research papers, it would be really nice rather than writing in words. Then is availability of resources. What do you have? From a single grant, you cannot ask for n number of equipments and instruments. No, that's a wrongdoing. Maximum 1 or 2 instruments, not more than that. But for that, you have to show how much do you have or how much is your management willing to put. For many projects, for example, recently, Nirma was called for first grant, right? And the input I could give them is check with your management how much they are willing to put. Government will give you 50% if your management is giving you 50%. Need for manpower. Don't be over ambitious. Where needed, take manpower. For example, we have a SERP project between four institutes, yeah, three from Mumbai, one from Bangalore. And we have asked for only two manpower. One will be at Bangalore, and in Mumbai, between three institutes, only one research fellow. That's sufficient. Devising time based goals. Many people do mistake here when you'll start writing the proposal. You give 10 objectives. Give maximum three broad objectives which you can fulfill in 3 years. People, on the other hand, feel that you are over ambitious and your project will not come through. So link that time. If you're giving it for 3 years, in first year, how much you will achieve, second year, how much you will achieve, third year, how much you will achieve. And then project the outcomes. So don't be over ambitious, is what I would like to tell you here. Already we've talked about funding, both national and international. Then comes the question how to select where to apply. So you need to read, at least if you're applying for government grants, see that you read what is there on their website. There are many calls. I told you indiabioscience.org, many calls. So read the grant proposal call, know the scope, and then see whether you fit within the scope. I'll give you an example. There was a call from DBT on sea buckthorn. At that time, I didn't know what was sea buckthorn. These are red berries, which you find only in Leh and Ladakh. And people, it is a seasonal berry, so it goes waste. So therefore, there was a call. They thought that much can be done with those berries. I knew that when pharma people will write, they will write on anti-inflammatory, anti-diabetic. That's what our people write, because that's what they can easily do. I also thought of a easy thing, but looked at what sea buckthorn contained. And I was surprised to see that it had one active which could act as anti-aging, and therefore I propose sea buckthorn nanogels. I know anti-aging is a huge market. So you can write on cosmeceuticals, not necessary that always think of pharma. Use keywords from call itself, that has better chance of shortlisting. So keywords is important. Applying is like applying for a job, because you need to identify what they want and then make your CV. So you need to definitely design how can you offer all those deliverables which granting agencies want. Also, be very sure whether you're writing a grant which is at ideation stage, very, very preliminary stage, where no one has worked. Most of the pharmacologists can work here because they are working on knowing the path, how a particular active will act. Biochemists, basic science people can work on ideation. But obviously, we need to work on POC and translation. In fact, there are Gyati grants for socially relevant research. Gyati stands for Gandhi Young Technology Innovation Grant. Again, there are not many applications, and we have been recipient of at least 4 so far. Because people do not apply, I would say. Not that they don't have ideas. Same way, we have got BMG, that's Bill Melinda Gates grant. How do you start? Read the grants that are funded by agencies in view. I told you, DST DBT page, you should keep reading. They are the major agencies giving you grants. BMG is another major agency. And all these agencies will also put, what they have funded. So you have an idea what they have already funded. So don't be in the same domain. Read the guidelines, make the outline. Very important. So, for writing your proposal, you need to be specific. Don't be vague. You need to be specific. You can't say nanotechnology for anti rheumatoid arthritis. Nanotechnology is a broad term. Within nanotechnology, what you're going to do. So, be specific. I told you, identify collaborators. Though it is optional, I always go with collaborators because you cannot be master of everything, right? If I work in formulation, I want pharmacologists with me, or I want someone who can do in silico predictions for me, so I can take them along. If my work involves making tissue scaffolds for, say, bone injury, I need biotechnologists with me. If I'm working with vaccines, I need immunologists with me. So don't think that you can do it all alone. It's not a wise thing. Know your audience, meaning know who's on the other side, what does the granting authority need from you. And I'll give you an example to so that be up to date always. As I told need to keep reading. From my master's date till date, meaning I still read at least, I'm saying at least, very truthfully, at least 5 articles a day. So that increases your knowledge base. And then, of course, follow guidelines. Organize in a proper way. So these are the general headings under which you need to write. Some headings might change depending on the granting agencies. It could be abstract instead of summary, right? It could be hypothesis instead of problem statement, so on and so forth. Coming to each one of them. Title. It has to be simple and original, yet it should be catchy. 50% of the grant is not, people don't read because your title is not conveying what you would be doing in that project. It has to be specific. Generally, in many grants, there is character limit. Character limit meaning in a word, how many characters are there, right? So they limit it to 50. So if your title runs long, 4 lines after 50, and it's online filling, it will not be seen by the evaluator. So please follow character limits everywhere. Sometimes they feel 250 to 300 is written. I can 302 ho gaya kya? What does it matter? It does matter. Also, it's not an English skill, but let the evaluator know that this project means a lot to you. What does this mean? Your title need not be very floral. It need not be, when I say catchy, it's not that English is what they are looking at. At the same time, it should convey exactly what you want to do. Taking the same example, nanotechnology for Alzheimer's. Rather than that, if I say which active I'm going to use and which system I'm going to use. So if my focus is, say, nanostructured lipid carriers of donepezil for Alzheimer's, that is specific, simple, it follows character limit, right? And it conveys what am I going to do. So because great title captures evaluators' attention with its uniqueness. All these points are same and important, like how will you write manuscript. So you can use these same points while writing manuscript also. Then comes abstract, summary, origin, different agencies call it by different name. I never write abstract in the beginning. Write full project and then you write your abstract, because abstract is a summary. That is the one which is giving first impression to the evaluator. It has to be again very specific. It should highlight what was the need of that project, what methodology you're going to use, and what would be the outcome. What is the expected outcome should be there in the abstract. And see that you have given relevant keywords as I told earlier. And this particular abstract or the problem statement should include purpose, objectives, some background, and convincing rationale why that need is there. what people have not done what you're going to do. That will highlight the novelty. So it has to have all these parts embedded. Give brief about unmet need, how you have expertise in that area, if you have, how you plan to meet this unmet need. So, what are your specific aims and objectives? Literature review, when they ask, they don't want 30 years, 50 years. Last 10 years is enough. In some places, it will be written also last 5 years. So, then restrict to only last 5 years. Include both national and international data. Not typically, I've seen that we write about international data and don't mention what is there in the national domain. Don't do that. Reviewers want to know if necessary preliminary research has been done to undertake the project. So if you have done it, specify, give your own literature. If someone else has done, please don't be selective and not put that. Many times I've seen evaluators doing it. Please remember, evaluators are not fools. When we get to evaluate, we put in keywords and we read what is in the general domain. Okay? For many people I've seen, specifically Indians, have that habit. One reference from where they had taken the idea, they will not give that reference. Doesn't work that way. Now I'm taking example from SERB. Why this particular one? Because it clearly mentioned what is expected of you. It's a high risk, high reward scheme. See this origin of proposal. Scientific rationale for doing this work should be elaborated. Not every grant will tell you this, but this is a very important thing to know. Risk elements and rewards, detail all the risk elements and expected rewards in the proposed research. Review, give international status, also give national status. Importance of proposed project, highlight what is a new gap which you will overcome. Is the project location specific? If yes, why it is location specific? So all those things need to be written very, very well. As far as project outline or work plan is concerned, now here generally there is no limit of words. Methodology, generally there's no limit of words, but people make that condensed. Don't do that. Give in detail the methodology so that the reader understands you have understood exactly what you're going to do. So enlist clear, focused, realistic objectives. Give details of how each of the objectives will be discussed or addressed. Not just writing particle size by zeta sizer. Not, you need to write. What would be the methodology? Will you be diluting the samples? Will you take RI into consideration? Why have you gone for photon correlation spectroscopy and not any other technique? All of those have to come. So cover the following points for each specific study. Overview, how will you do it and what do you expect? See this, the work plan, they write, it should contain all elements of how each of the objectives will be addressed. This section must be detailed, have clear plans, not vague, no generalized statements. It should have several schemes, tables, figures, equations. Hardly I have seen any of the projects where schemes are mentioned. Very important. Now, for example, you have two people from your side, two people from other side, right? What would be the flow of work between them? So from in silico, something is going from pharmacology, and on the other hand, from in silico, something going from formulation and then going to pharmacology. Both should be interconnected. Very important. Then they ask you about expertise. So obviously, if you do not have expertise, this is a question which many people ask. If you do not have expertise, at least your collaborator should have expertise in the area which you are proposing. Because you need to give some patents, some publications to make them aware that you have that expertise. I've already told you number of personnel should be governed by what project you are submitting, for how long you are submitting. You need to have tenure and budget justification. Budget should not tilt. Okay, keep a balance. It would be a good idea that you make a PERT chart or a bar diagram to indicate there could be overlapping objectives, right? So that you know exactly in how much time you'll finish your project. And at the end of each of those planned objectives, enlist milestones that if this is there, I move to the next one. If this is there, I move to the next one. In a nutshell, if you are not clear in your mind, authorities can gauge from the way you have written that it is an open ended project. No one wants to fund an open ended project or an exploratory project. So ensure feasibility, reflect coordination of activities, and keep buffer time. Very important. Being in academic institutes, suppose UV lamp conks off. Do you have it in inventory? Zeta potential lamp goes off. There's a power failure because of which stability cabinet stopped working. So you have to have buffer time. Budget has to be appropriate, necessary to execute the project. See that you acquire quotes in advance. Nowadays, granting authorities are asking you to upload even the quotes. Justify. Justify resources. Comply with the upper limit. You know, the upper limit they've written is 20 lakhs. Don't ask for 50 lakhs. Then comes list of facilities. So see that you list all facilities which you have. Then comes expected outcome or concluding remarks. Again, here, please do follow character limit. Justify project rationale. So, whatever rationale you started with in expected outcome that should come in some other way, and list relevant endpoints, reflect completeness of the project. This is very important. Always you should have alternate approaches. Even the evaluators will look at if you propose something, you propose that I'll work on, say, lipidic nano carrier system. That doesn't work. So, in alternate strategy, give us polymeric nanoparticles. Or if one particular route doesn't work, sorry, I'm taking examples from formulation because I belong to that area. If you written nasal doesn't work. Not sufficient concentrations are going in brain. IV can still work. Vaccines, specifically nasal doesn't work. Intradermal can work. So those things need to be kept in mind. Again, few tips: read call of proposals carefully. If you have any doubts, contact the program coordinator. Plan your proposal writing and compilation well ahead of deadline. Don't wait till last date, everything gets jammed. Check the funding agency website. Sometimes they extend the deadlines. Sometimes, in one case, even early closure was announced because they had flooded, with projects. So they announced early closure. For online submission, register immediately. It's very important. Go on feeding, maybe even XYZ or few sentences and see what they need. Because sometimes even the agencies have not clearly written what needs to be uploaded. Okay, and you'll realize only when you start uploading the project, oh my God, this another information is needed and that requires 3 4 more signatures of authorities. So sooner you start filling dummy information as I've written, sooner you'll get to know what exactly is needed. Use PubMed, Google, Patent Scope, all the tools for literature review. While you're writing international and national status, you should know what the national researchers actively working. Why I'm saying so? Because most of these researchers would be on the other side. So it shouldn't happen that you miss on miss out on them. So these are the levels of funding. Just give me a second. There's a call. Hello. Wrong time. I'll call you back. Okay, these are some of the case studies which I'm presenting. So I told you we got SERB core research grant, and you can see that it is individual centric. I have marked, highlighted the points which I want you to read. And here the objective was that researchers should be able to undertake R&D in frontier area of science and engineering. And of course, it was written about PIs and co-PIs. Also, it is written about plagiarism. It's very important. Okay, so see that in grants also, like your articles, research articles, review articles, you do plagiarism check. Very, very important. It's unacceptable. Then they have given procedure for how to apply online. So this is the pre-submission file. You can see it was for development and evaluation of nanocarrier based novel foot and mouth disease virus vaccine for non-parenteral delivery. So by giving this title, I have told that I will be designing a vaccine which will be given by non-parenteral route, and it is a nanocarrier based. Very clearly, I have indicated that. So this particular project was, as I told you, between us, Bombay Veterinary College, BVCOP, and IVRI, which is the only institute. I mean, the industry institute, actually, I would say. They are the only one having this foot and mouth disease antigen and the authority to give it to anyone. So we had to collaborate with them. So we got approval letter. Now, what I'm trying to say is just getting approval letter doesn't mean that it is done. You can see that after that also they have indicated within 20 days some information is needed. So if you don't upload within 20 days from date of this letter, you tend to lose the project. So we had to provide this information. And then, of course, we did get the project. This is another one, Bill and Melinda Gates Foundation. There was a global challenge under One Health concept. Now, what is One Health concept? Some solution which can work for animals as well as human beings. So we saw opportunity there. And what was the opportunity? We thought that we could make again a vaccine for brucellosis, which is a disease which affects animals and also affects human beings. You can see it was there in BMG. All the diseases were mentioned. So we picked up brucellosis. Okay, why did we pick up brucellosis? Because before this, we have worked on diagnosis of brucellosis. So we were familiar with this particular disease. So we thought we have diagnostic methodology, which was also nanodiagnostic. If we have vaccine also, we have covered the full domain. See, now what is very important here is this is not huge project which runs into pages. It is only 2 para project. So that means you have to have a very, very crisp rationale. And yes, collaboration definitely would work in our favor because antigen which we were using was extracted already by someone from Bombay Veterinary College. So we thought we'll take advantage and move fast. Why we wanted to take advantage? Because project was only for 18 months. In 18 months, it was impossible for us to do antigen extraction, characterization, nanovaccine formulation, make it stable, so on and so forth. So we collaborated and nano vaccine we made for brucellosis using green technology. And you can see till today, on their site, you can see our name on BMG site, which really gives you another level of satisfaction. These are the projects which I mentioned during COVID time. People used to sit at home, but our team is so active. We used to brainstorm every day and come out with projects We listed 15 projects and we submitted two, happy that both of them came through. So this is how they had asked for the project, very, very brief project they had asked. So we had to make budget, etc. Outcome was that we did get the project. You can see this with reference to your letter of intent entitled intranasal mucosal vaccine for COVID-19 infection. Now, why I'm showing you this? We could work on this only because we have worked on brucellosis and we had a platform. So we knew that platform was working. So in that platform, can we put spike protein? And second dimension which I had added was people are giving pricks. Can we make it intranasal? And I'm so glad that now intranasal is in the market. So they provided template. This stage, they had a very short uh, video they asked from us. They played that video so that they can restrict our time. And then for question and answer session, they are asked us to come, meaning again virtually, but it was grilling. The pre-award, you have to, of course, identify funding agency, prepare the proposal, then submit the proposal. And post-award, also you have to do work. Why are we getting government projects? Because we are submitting our utilization certificates in time. Whatever money is asked, that's spent, that needs to be shown. A separate account needs to be kept. So if you are able to do that and you are able to give project completion report, they are very happy. One thing which I advise, someone who is very close to you, on whom you can trust, I would say, because many times it's patentable project which you are submitting. Get it read from reviewer's eye before you submit. You'll get many leads. And after doing all this, also, if it gets rejected, work constructively. Take their points and work constructively. I think that's the end of my presentation. This is our research lab and all the facilities which you can see, be it USP Type 4 apparatus, Zeta Sizer, we have Beckman ultracentrifuge, we have permeation assembly by Perm Gear, Rotavap. We have behind this, look, behind the TV screen, which you can see is a cell culture lab. We have three HPLCs within the lab. We have a UV, we have a ELISA reader, all within the lab. All this is through government grants. So we started in a very small note with the beaker, right? Got seed money of 15,000 from Udacity. And of course, it's been a long journey, but a very satisfying journey. We've been able to transfer all these are some of these are nano products. These are devices. We've also, besides stents, given intrauterine device to WHO. All these became very important during COVID time. Vitamin D. This small capsule has 60,000 units. Curcumin capsules. Even this product, Imuvac, it was under clinical trials because it's a very good immunomodulator for COVID. So we work with this motto. And if you understand this motto, means focus. So whatever you've taken in hand, if you focus, you're surely going to get it. So this is thank you from VBP Research Group, and I'm open to any questions which you may have. Always remember, secret to getting ahead is getting started.
Now we have come to the end of today's valuable session. Thank you so much, ma'am, for such an informative session. Ma'am, there are few questions asked by our participants. With your permission, can I move ahead with the same?
I'm perfectly fine. Sorry if I have delayed you all.
No, no, ma'am, it's absolutely okay. So, first question is, how can we collaborate for foreign funds?
So you, as I said, from literature, you can find out who are the people working. And all in all research paper, their addresses, email addresses are there. So start writing to them, and very clearly outline what you would like to do and how you want to collaborate. So make a letter, send it to them, and you're sure to hear from them. My experience meaning everyone comes back, because in their profile also it adds, if they are working or collaborating internationally. So just a small email will do.
Thank you, ma'am. Second question is, what are the five important factors for the proposal to get selected or accepted?
First is the idea. Major is the idea, I would say. We look at novelty as a first criteria. So second is whether there is a unmet need. Meaning, if you are giving me something which all others anyway are working on, or it is there in the market and it is not going to give any benefit, it is of no use to me. So why should I spend money on that? So second, definitely, meaning you identify unmet need. Third is whether you have POC. I would say that at least do some prior studies, to get the lead that yes, this particular idea is going to work. Even evaluators are not sure. If you this happens only if you have same scoring proposals. So then we see whether someone has given POC. If someone has given, that means yes, they can move faster. So third is, I would say, POC. Fourth definitely is your grammar, that puts off many of the evaluators. In fact, the project, the way it is written, it can put off many evaluators. So pay attention to proposal writing. And then, as I said, budget has to be in sync with the time the project has been proposed, as well as the work it intends doing. I would say these are major ones. Everything is secondary.
Thank you, ma'am. Third question is, more PIs in the project, whether it will cause disadvantage or disqualifying?
No, no, it doesn't call disqualifying. It's only that egos clash. So, we teachers are known to have our own egos. Sorry to say that. But some point of time, it may happen that if you are at the same wavelength, nothing happens. But sometimes, people tend to play a blame game, and there it creates problem. So, PI, one is a good idea. Co-PIs can be many.
The fourth question is, ma'am, to be PI of the project, whether prior publication will provide added advantages?
100% yes.
So the fifth question is, where can we find models for project proposals? It's the need of the hour for current generation to quest their research fundings.
Models. I can help you, meaning I can give you my own proposals if you wish, but then otherwise there are no models available like that. I mean, I would say that the example which I gave you of serve high risk, no high reward, you read that particular scheme, and I don't think you need anyone else's guide document. You will be able to do justice.
Thank you, ma'am. What are some common mistakes to avoid when writing a research grant proposal?
Uh, Again, I would say that do not be over ambitious. As I mentioned, earlier also, people give 10 objectives, and evaluator feels that even three are difficult to achieve in 3 years. So don't be over ambitious. So one is that. Second is not giving recent literature survey. No, people give uh, all the data which is age old, but they don't give recent last 5 years. I've seen many projects. That's because they take some projects from somewhere, and which was done probably 5 years back, work on the same line. So give literature survey. In fact, one step ahead, I tell you that not only give literature survey from research, also give patent survey. That increases your chances, because you are understanding that what is there, which industries have also done. uh, so do this, and use Grammarly, use Mendeley. Sometimes even formatting of the project is not done. I mean, simple things I think we can take care now. Now we have everything on our fingertips, right? So use reference manager, do plagiarism check. First thing they'll do is, they uh, put your whatever project summaries there in plagiarism software, generally authenticate, and they'll tell you 50% plagiarized. Then what are you going to read? I don't read, I straight away reject. So avoid plagiarism also. Yeah. I think most of these things I've told in my deliberation, but I don't mind reiterating that this has to be done.
Thank you, ma'am. One of our participant has a query regarding participating in such schemes, but being new to this field, sometimes it is really hard to even think and execute. So, is there any option for me to work with someone who is already doing his or her projects?
Answer is yes. So I think you have to go all out. Basically, as I said, for international ones, even finding national collaborators, you can write. And if we see merit, for example, someone comes to me, obviously we discuss, and if we see merit, we don't mind collaborating. So this person, I told you about SIR project, right? Bharati Vidyapeeth College of Pharmacy is a private college. So he came up with this idea that can we write a project together involving IVRI, which is from Bangalore, and looking at the merit, looking at the passion which he had. Uh, if I said yes, so I mean, likewise, I'm sure many more of us would be approachable and ready to say yes.
One of our participant is having one query, ma'am, regarding how to avoid plagiarism or how to go for paraphrasing.
This is an art by itself. You can start with reading a para, writing it in your own words. So this was taught to us when we were studying in school, right? So same thing you need to do with the research related articles also. And of course, Arkund and other things don't help, let me tell you. What you get as 20% in Arkund as a software, you'll get 80% in Authenticate. So even the authorities need to provide you with good softwares which can detect plagiarism. So how to work on it? I think it's only by experience. So you go on writing. I remember that you'll be surprised probably that I'm from a Hindi medium school. So basically that's how we learned English, right? So reading, Reader's Digest, Reader's Digest at that time, I don't know today also whether it exists, used to give 10 words with the meanings. So that's how I started learning, reading newspaper, writing that newspaper, one para in our own words, which our parents used to make us do to improve our handwriting. But I'm really happy today that everything has come to our advantage. So same thing can be done. You can take technical literature and paraphrase, and then see, put that full para and see how much of it is plagiarized. Will come by experience.
Thank you so much, ma'am. Now the session is open for all. So if anybody is interested, can raise their hands, put themselves unmute, and can ask questions one by one. I can see Padma Bhushan Carey. You have raised your hand, sir. Am I audible to you, sir? Okay, fine, ma'am. By the time we will take some more questions in text. One question is how to check where to start reading because in the midst of research study, we generally move away from the main selective topic.
Sorry, could you repeat? I got disturbed. Yeah.
Yeah,
Could you
sure, ma'am.
repeat?
How to check where to start reading because in the midst of research study, we generally move away from the main selective topic.
Doesn't matter. Knowledge is also every day important. It might be useful at some other end. So I suggest, in fact, you should read about your project to be in the mainstream. But apart from that, also we make our student reads lot of regulatory guidelines. It will definitely help them moving ahead. So there's no stop to reading. Keep reading.
Thank you, ma'am. So we have one hand raised. Saurav sir, if you have any queries, you can unmute yourself and ask.
Yes, thank you so much, ma'am, for this informative session. Ma'am, I just would like to take your personal comment or like professional comment based on nowadays there are a lot of studies are going on based on this metallic oxide nanoparticle and inorganic oxide nanoparticles. Every day we can see like a thousand of research and review articles are coming in the public domain. How you see these inorganic or metal oxide nanoparticles in the translational research, ma'am, especially from the therapeutic side?
I wish you had not used the last three, four words. Yes, I have my own reservations about it because when you say metal, over a period of time, especially if you're using it for chronic therapy, you never know where it goes and gets deposited. So it is not easily eliminated. So if it gets formed and goes, meaning I've told in other forums also, if it goes and sits inside mitochondria, you never know tomorrow what functions will change. So I have my own reservations about metals in therapy. Nevertheless, for diagnosis, I think they can be utilized to maximum capability.
Ma'am, is there any changes when previously we used to see there are a lot of research article as well as proposals based on only the therapeutic, but nowadays that theranostic part is also added where people are also considering both the aspects. So, like now, whether the scenario has been changed or whether it will be like remain the same.
So yeah, I agree with you that theranostics, but theranostics specifically, for cancer and neurodegenerative people have started using. For infectious diseases, still theranostics are not being used. All said and done, the moment you say theranostic, meaning you are increasing the cost. So definitely that is an emerging area, and people will work on it for some time till as I said, you come up with non-metallic diagnostic agents. If you can do that, nothing like it. For example, again in one of our study, uh, it was for glioblastoma. So there we have utilized radioactive substances along with active moiety anti-cancer drug, and this will be used as theranostic. Or you use something like carbon dots, which are functionalized carbon dots, because carbon is what your full body is made up of. So something which is part of your body, you use, and there won't be any problem. But otherwise, I foresee problems later.
Thank you so much, ma'am. There is one more added questions from our YouTube viewers. So the question is, most of the time it has been seen that if there is any project in nano things are there, nanotechnology, or whether the reviewers will think like as this nanotechnology or nanoparticles will not go much in the translation research, so will reject that proposal. Is there any chances for that?
Yeah, I mean, see, it's not only one single reviewer. Let me tell you, for every project there are at least 3 to 5 reviewers, and depending on the scoring which we generally give, it will be decided. And after that also, now suppose if everyone has given marginal, if 60% is passing and all have given around 60, then that person definitely will be called to present. Meaning if the authorities are not able to take decision, he or she would be called for presentation, and then the decision would be taken. So it is not a single reviewer thing which is taken into consideration. Yeah, it has to have, obviously, meaning I know because I have fought for my own projects. When I started working on NLCs, the evaluators said that you work on liposomes, they are already established. I said, I don't want to work on liposomes. I know what are the problems of liposomes, and therefore I would like to work on NLCs, right? So I had to fight my way out. And I'm very happy that first year I did get the project. And first year when I demanded for more money, I got more money also. So such things also happen, that you need to be very firm. And if you understand your proposal very well, I think you can fight and move ahead. I'm not saying fight. Very politely, you can always mention whatever are your points.
Definitely, ma'am. Thank you so much, ma'am. Thank you, moderator, ma'am.
Ma'am, we are having actually many questions, out of which I would like to take some two, three more questions in the text box which we have received. One is the query is, the ma'am, can private research scholar be able to apply for research grant in pharma field?
Private research scholar meaning research scholar in private university.
Yes, yes.
Yes, I think, ma'am, research.
Yeah, I mean, yes, anyone can be entrepreneur. Government encourages anyone, please. If you have an idea, obviously you can.
One more query is there, ma'am, that how to write for international collaboration as a host institute.
As a host institute,
Yes.
can you just, someone, whoever has asked, can they clarify? Because I have already told you, right, that all you need to do for international collaboration is write to the collaborator. Now, probably the question is, if rather than person specific, whether it can be institute specific. Maybe I can take it as that, host institute wanting to collaborate, right?
We are having that participant, ma'am.
Ma'am,
Like,
can I clarify? The question
No.
was mine.
Yes, please.
Yes, ma'am. Actually, I want to know that suppose I want to go for an international collaboration or rather international grant. So to avail that particular grant, I need a host institute in the international level. So how can I get that institute? So
You
how
get
can I avail that particular thing?
right. So you get the host scientist first, and that scientist will get you the institute. Okay. So you need to identify a person. Person is ready, institute will be ready. I hope I answered.
So then, ma'am, how to influence that person? As in the international level, suppose I don't know anyone, then
So
this
you,
is my first
that's
step.
what you do. Right. So this is your first step. As I told earlier, from your reading domain, you will know that this is a person with whom I can work, or maybe four or five people with whom I can work, right? So you, just like, our students apply and give SOP when they go abroad, right? They write what they wish to do. So you make a proposal that this is what I want to wish to do. This part of the study, I am ready to do it in India, but for this part, I seek your support. So will you be willing to collaborate? Put it in the mail, in a very nice mail. So make a small proposal and say that this is why I wish to collaborate, either because I do not have the facilities, or maybe uh, I've read your literature and we know that you know you have very high impact research. So it has to be, a letter has to be framed and sent to them with why you want to collaborate with them.
Okay, ma'am, understood. Thank you.
ma'am, one more question is there. By the time, Mantri sir, are you?
Yes.
Yeah.
Mandana madam, namaste. I know
Sir,
you personally, and 2021 you came for the dry powder inhaler, your webinar with the Damasar College.
right,
I
right.
do not have any question, madam, to see you everything, and always, madam, your inspiration, madam. Always, your all the presentations, and every time I'm looking your publications, presentation, always your whole achievement, madam. And thank you very much, madam, for giving such a wonderful session, madam. I came to know very easily, madam, what you explained today from, actually it was switched off my camera, but I was listening each and every line. It was very nice and very, and thanks to Mr. Saurabh Mahanto, Adrija madam, and all NFI University for conducting such a very informative session, and especially you invited to Vandana madam. I'm very happy for that. Thank you all to UNFA University. Thank you, madam. Thank you, Vandana madam.
Thank you. It's always a pleasure. In fact, interacting. My aim is only that make my India proud, and the more people write research grants and more we go higher up, and no one will be happier than me.
Yes, madam.
Ma'am, last two questions we have. One question is anti-aging activity of berries, which you have highlighted from your own project. Method or models were based on genetic level or other. That is Drosophila melanogaster model.
No, meaning I did actually human testing for that. So we got clinical efficacy testing, approval, and we could show how the hydration was improved. Major is the aging skin loses moisture, because of which wrinkles are there, right? And if you are able to rehydrate them, that means it will act as anti-aging. So we could do a lot of parameters in a clinical setup with the CRO. We were very fortunate that that CRO helped us without taking any money. See, that's what happens when they know what are your intentions. They do come forward and help. So we could finish that study very successfully and give the formula. We have given the formula to industry also.
Thank you, ma'am. Vani sir has raised his hand. Sir, am I audible to you?
Yes, ma'am. Yes, you're audible.
Yes.
Thank you so much.
You can
Uh,
proceed with your questions.
yes, yes. Good evening, Vandana ma'am.
Good evening.
Thank you so much for your very valuable session here. I have actually one question. I'm a research scholar. So while writing any research proposal, there is a problem for narrowing down the research questions. So while writing any research proposal for granting, so narrowing down the research question is a little bit crucial part. And sometimes researchers may have some broad ideas, but the funding agency they prefer to support the projects which have some focused objectives and measurable outcomes. So when it comes to that part of any research proposal, what suggestions would be from your side to those researchers or to those upcoming new researchers or new professionals who are willing to write any projects and for any agencies? So what should be the suggestions from your side for especially for narrowing down the research question, because this is the critical part. Thank you, ma'am.
Very, very correct. In fact, meaning again, I can give example because I'm in the formulation arena, right? So narrowing down the questions would happen only if I understood clinician's perspective. So I understand from them, whether if I take ahead this particular formulation, suppose I say that, taking example of psoriasis, right? So you need to design a questionnaire for them. What would they prefer? A cream, a gel, emal gel? What would they prefer? Right? Talk to them. So if they say that gel, then you have to know why gel. So if they'll say that okay, gel because it is not oily, easily it can be washed off, then that's a challenge for you, because if you're working for psoriasis, you want that the active which you have used, it should get localized in the upper layers. And we have read that gels are the ones which permeate much better as compared to creams and other things,
Yes,
right?
yes, yes.
So that's where the confusion comes. So that means then you have to design a strategy whereby you can get best of both worlds. And that's how we design solid lipid nanoparticles for anti-psoriatic drug. But we added those solid lipid nanoparticles in a gel base. So now those people wanted gel. Why they wanted gel? Because it is washable and it is transparent looking. And by making these colloidal particles, SLN particles, I have achieved my objective. That gel also I have given, and I know that SLNs will go and get lodged in the upper layer and will not be permeated as easily as otherwise gel would have done, right? So this way, you need to think whether I should be making micro immersion. No, because they'll permeate fast. Micelles very fast. Shall I go to NLC? NLC is also in between SLN and micro immersion. So they'll also be permeating. So what do I do? Do I do SLN? SLN can be done, but they are not very stable, right? They're not very stable. So you will have to take special efforts and select the lipids which can give you stable SLNs, yet which can be put into a gel. So that's how we narrow down the approach to be used and the questions to be asked. Yeah.
Actually, that is the problem, with the, we can say the young professionals or young researchers, because they have not that much expertise of, of that very particular field, and they have to go in depth into it. So this type of challenges they will feel, and if they are writing some proposal, funding agencies are, leading some questions and, making some, queries for that. So this was just a, concept clarity that what we people should do, because uh, most of the research professionals, research scholars who are still, pursuing PhD, many of them are much more willing to do some, for research grants. But the concern is that they are not that much expert in it. They have to do some type of, practical work where they will feel and they will experience these hurdles, because we cannot overcome them until we will experience them once in our life, actually.
Yes.
Thank you
I
so much, ma'am. Thank you
I
for your.
understand that a very
Yes.
valid point asked by you. And I can only say that, in the area in which I'm working, I'm open to anyone coming to me. Same way, you may be able to identify people who are approachable and have that kind of experience that they can do hand holding. So I think with that, you can move on. It's very important, younger generation. Definitely, there are some very good, I would say, researchers, but they sometimes lack direction. So it definitely can be done with the experienced people's hand holding. Thank you.
So here we end up with the question and answer sessions, ma'am. Thank you everyone for taking up such questions. Now I would like to end up the session by the vote of thanks. So for the same, I would like to request Mrs. Prajita Biju, Assistant Professor, Department of Pharmaceutics, for giving the vote of thanks for today's session.
Honorable Principal Sir, a valid invited guest, my dear colleagues and students. Good evening, everyone. I, on behalf of Department of Pharmaceutics, Anuppaya Pharmacy College and Research Center, take this opportunity to present the vote of thanks. I thank the speaker, Dr. Vandana Patrawale, for the informational session on the topic Research Grant Proposal Writing and India-Centric Research Funds. I would like to thank our principal, Dr. Mohammad Gulzar Ahmed, for standing along in coordinating this event. Dr. Aisha Khan, Assistant Professor, Department of Pharmaceutics, Anuppaya Pharmacy College and Research Center, for coordinating this event. Last but not the least, a heartfelt gratitude to participants, colleagues, and dear students. Thank you, one and all.
Thank you so much, ma'am. I would also like to thank all the higher officials of NFOA deemed to be university for providing us all the facilities and permission to conduct the guest talk. I would also like to thank the IT department of NFOA deemed to be university and NFOA Pharmacy College and Research Center for supporting us to conduct this virtual session. Last but not the least, I would also like to thank all the participants, those who have joined from various institutes, majorly from JSS Mysore, Osmania University, Kerala Health Science College and Hospital, Dr. APJ Abdul Kalam Azad Technical University, Rajiv Gandhi University of Health Sciences, Assam Downtown University, BIT Mishra, and many more. Thank you once again for joining this session. We hope your presence and support in the future sessions too. The feedback link has been shared in the respective platforms, both in the Google Meet and the YouTube. Kindly share your valuable feedback to the same. Thank you once again. Thank you, one and all.
Thank you.
Thank you, ma'am.